Ranking Member Cole, and thank you to our panel for being here today. Chairman Pallone, I believe that healthcare is a right. It isn't a privilege. You don't get to watch me die on the side of the road because I'm too sick and too poor to see a doctor. We don't do that to people. We take care of them. At the same time, I think that we are working with an administration that we simply can't trust. It's trust but verify. When we continue to see the lawsuits pending to undo the Affordable Care Act, when we continue to see the erosion with a refusal to fund the high-risk pools, when we continue to see movement on allowing employers to dictate what part of medical help they're going to fund for their female employees, when we continue to allow the haves versus the have-nots to sell junk plans to someone who isn't able or doesn't have the privilege to be able to read through the legal language and understand that what they're buying really isn't going to help them pay for the basics that they need, isn't going to cover the medicine that they need for the health issue that they have, or isn't going to cover the doctor or the specialist that they need. Everyone deserves to have access to affordable health care and quality care, regardless of their pre-existing condition and regardless of their ability to pay. In 2010, the American people took a historic step forward when the Affordable Care Act became law. I have a constituent who I recently talked to, who for years had gone without health insurance until the Affordable Care Act was passed into law. Her name is Wendy, and Wendy has type 1 diabetes. And before the ACA, insurers would deny her coverage, which they can no longer do. Wendy is now on an extended medical recipient coverage in California. For Wendy and for more than 100,000 of my constituents in California's 35th Congressional District, the ACA has been a lifesaver, a lifeline. It's a way for them to be able to see a doctor and get the health care that they need and they deserve. We care about people. We don't just care for them when they're in the womb. We care for them when they're grown and old like you and I. Through Covered California, they now have access to health care coverage through Medi-Cal or a plan on the exchange. Recently, the Trump administration revealed its intention to repeal the entire ACA. And if President Trump has his way, Wendy and many people like her would no longer have insurance. Because let's face it, insurance companies are in it to make some money. And they're going to make money where they can. And where they can is refusing to cover people with pre-existing condition and insuring those who are more healthy and younger. This debate is more than just about numbers. I mean, we're talking about real people, like our colleague, Mr. Hastings. We're talking about real people with real issues, real healthcare issues, and they should not be denied coverage for a pre-existing condition. HR 986 will help to protect the ACA and the American people from the Trump administration's sabotage. And I am pleased to see this critical piece of legislation be considered by the Rules Committee, and I hope that we would move it forward. Anything more that you want to add, Mr. Pallone, as to the issues? States like California have been very progressive at ensuring that people of all ages have access to their health care. I remember coming to Congress and for the first time having to buy my own health insurance not through a familiar covered California exchange, but through the DC exchange and the limited plans that I had to purchase health insurance through. Of course, I chose a plan that I thought I've always had, traditionally had. I didn't realize that my health insurance had different types of plans. Of course, I chose the cheapest option that should have been for a healthier member of Congress than someone with a pre-existing condition that needed to go to the doctor more often. So yes, I did have a higher family deductible. That wasn't the right plan for me. And it wasn't until the second year that I actually read through all of the documents and figure out which plan was best for me. So part of our duty is to ensure that people are understanding what they're buying.
Absolutely, and that's part of the problem, which is going to be addressed in the legislation that I think you'll get next week, because the Trump administration has eliminated 90% plus of the outreach and the navigators and all those things. People don't understand what they're buying when their states pursue these waivers. I mean, I'm trying not to repeat, but progressive states, California, New Jersey, right? They've used these 1332 waivers in a positive way, because the idea was that you could experiment, but you couldn't make things less affordable, less comprehensive, or have fewer numbers of people insured. So they applied and used my state for a reinsurance waiver because that wasn't available anymore under the ACA. Now that meets these criteria, because what you're doing with a reinsurance waiver is trying to get more carriers into the marketplace, because you may only have one or two and you want to have three or four, right? And so you lower the risk for those carriers. They come in, they're still offering the comprehensive coverage, they're still offering an affordable product, and you're not decreasing, you're increasing the number of people that can get insurance, because you bring more carriers in, they're more competitive, but still within that regulatory framework, and you accomplish the goal. It's an experiment, if you will, or a waiver that accomplishes the goal. But if you're in a state that decides to ask for a waiver and allows you to, eliminate coverage for maternal health or God forbid, hospitalization, then it doesn't meet the goal, because it's not comprehensive coverage anymore. So that's all we're saying here. You can say you don't want to get rid of this, you still want to eliminate discrimination based on pre-existing conditions, but it's kind of meaningless if you're going to now offer a policy that doesn't provide what the person needs. It's meaningless.
It's meaningless if I am a young woman and I need a yearly pap smear and I need to get access to birth control pills or birth control period, and I am denied that coverage because this Congress has decided that my employer could deny me those benefits. That to me it is not what the Affordable Care Act is about. It is about insuring people for the types of insurance that they need, or health care that they need. In California, this is what I hear from the insurance companies. The instability of this administration is causing them, to have to look for ways to insure now and protect themselves for the future, because they don't know what's looming with the next Congress. What is the next vote? If we voted 64 times to repeal the ACA, are they going to be successful one of those 64 times? And then what? Do we start from the bottom again? It doesn't make sense. With that, I will yield back to Mr. Woodall.